Good morning, everyone. Thank you for joining us today. This is the Rock County Public Health Department Media Briefing for March 3rd, 2022. This briefing is being streamed live on the Rock County Public Health Department's Facebook page. The recording will be available on our Facebook page and will also be uploaded to our YouTube channel once this briefing ends. My name is Jessica Turner. I am the Communications Specialist for the Rock County Public Health Department. And joining me today, I have Nick Zupan, epidemiologist for the Rock County Public Health Department. So as always, we will start with some COVID-19 updates from the Rock County Public Health Department, and then we will open it up to questions from the media. So I'm going to turn it over to Nick now to start us off with some data updates.
All right, thanks, Jessica. So over the course of the pandemic, we have had over 36,000 confirmed cases of COVID-19 among our residents. But we're really in a period of low case activity right now where we're averaging just 19 new cases per day over the last week. You know, this is still not zero, but it's pretty low based on where we have been. So we're seeing a steady decline in our case activity right now. We have had 317 deaths due to COVID-19, and most recently there were 7 patients in the hospital as of Tuesday getting care for COVID-19. So there's still some people who are becoming severely ill with COVID-19, but by and large, we're seeing pretty significant decreases in our hospital patient levels as well. In terms of our vaccination status, those numbers are starting to slow down in terms of the level of increase. We've almost reached 64% of our Rock County population having received at least one dose of the COVID-19 vaccine, and almost 61% of the population have completed that original vaccine series, and about 31% of the population has received a booster. So not seeing very large increases in our vaccination levels, but still seeing on a daily basis more and more people getting vaccinated. So that's all I have for a data update. I'm going to turn it back over to you, Jessica.
Thanks, Nick. So we've got some more encouraging news today, and I think it's fair to say that we're all relieved to see that the infection rates are declining, and the general feeling across the nation is optimistic and throughout Wisconsin. While we can't predict what the future of the pandemic will look like, we are also sharing in that optimism. Based on the latest data that Nick just reported and the recent updates to the CDC recommendations, we did issue some new COVID-19 prevention guidance earlier this week. It included the option for Rock County residents who are in good health to take a break from mask wearing during this time of low transmission. We do encourage individuals with high risk for severe disease to talk to their healthcare providers to see if they should continue wearing a mask or following additional prevention measures. And of course, anyone may choose to wear a mask at any time based on their personal risk or comfort level. Anyone who has symptoms, a positive result, or has been in contact with someone who has COVID-19 should continue to wear a mask in those situations. Masks are also still required on public transportation and in transportation hubs such as airports, and individuals should also continue to follow any mask requirements that are in place at healthcare facilities, businesses, or places of employment. If you do choose to wear a mask, or if you need to wear a mask for any reason, the best type of mask that will give you the best protection, even if others aren't masking, is one that has the best fit and the best filtration. And in most cases, that would be an N95 or KN95 mask. So I think we're all breathing a collective sigh of relief, seeing how much lower the COVID-19 transmission rates are after that Omicron surge. And that's a very good thing. However, we continue to recommend that everyone who's eligible to get vaccinated do so and stay up to date on your boosters. This significantly aids in the effort to keep the transmission levels low and prevent that severe disease and death when infections do occur. Everyone should continue to get tested if they have symptoms of COVID-19. And beginning next week, you can order another round of the at-home COVID-19 tests free of charge from the US government at covidtest.gov or by calling 1-800-232-0233. So if you did order those at-home test kits initially when those first became available, you can now order another round of those tests beginning next week. You can also find other testing options in the community by visiting our refreshed and redesigned website at co.rock.wi.us. And then just to transition to national news, the US government issued a new coronavirus plan this week aimed at ushering the United States into a new normal with 4 main goals: protecting against and treating COVID-19, preparing for new variants, avoiding shutdowns, and fighting the virus abroad. The plan was unveiled during the State of the Union address, and much of it mirrors the processes that we have been utilizing and refining to manage COVID-19 already, along with some new key initiatives. For example, the administration pledged to work with Congress to give schools and businesses guidance, tests, and supplies to stay open, including tools to improve ventilation and air filtration. We'll continue to follow updates regarding these efforts and what they mean locally, and we'll be sharing that as we learn more. Given the lower infection and transmission rates, we're also likely to see decreases in vaccination and testing hours in locations throughout Rock County. We have seen this a little bit already with our community-based vaccine clinic, but we may be seeing some more in the near future if our case rates remain low. We've already seen a significant drop in the number of people who are accessing these services, and that trend appears to be continuing. So we'll adjust as the numbers dictate and keep everyone up to date as changes occur. Also, the frequency of data updates we provide on social media are likely to decrease as we're going forward because we're not experiencing significant day-to-day fluctuations. Like we said earlier, though, we can't predict the future, so we're continuing to keep an eye on the data, and we are prepared to make adjustments again if the situation changes. We do want to sincerely thank Rock County residents who have been doing everything within their power to protect themselves and others over the last 2+ years. We deeply appreciate the community effort, and we are thrilled to be sharing this more positive news this week. We hope the trends continue, and no matter what the future might hold, we will continue to be here to provide breaking health information and answer questions. So on that note, we will turn that over to questions from our media. It looks like we have Austin Montgomery from the Beloit Daily News joining us today. So Austin, we will give you the ability to mute and unmute. And since you're the only media partner in attendance, you can go ahead and ask whatever questions you have.
Thanks, Jessica. We really appreciate the health department doing this. We think it's been a good resource to be able to get information out to the public. Obviously, everything you've said today is pretty optimistic, and we've been seeing that over the last couple of weeks, so that's really exciting. Just wanted to ask Nick a question. Is this period of low transmission kind of similar to what we saw in June and July of last year? Or is it different? Just kind of wanted to compare the two periods because I think those are the, aside from right now, the other time we saw pretty low transmission. Are we in a better position today than we were then because of more readily available vaccines and also kind of increased vaccination numbers? Just kind of wanted to get his thoughts on kind of the comparison between the two periods of low transmission and how this time might be different. Thanks.
Sure. Yeah, thanks for the question, Austin. In terms of the case activity that we're seeing, it's slightly higher than we saw in the summer months last summer, but kind of the trends are following a similar trajectory where we're seeing pretty low levels of case activity, low numbers of new hospitalizations and those kinds of things. If you look at the new CDC metrics that they released in coordination with their new masking recommendations, we're currently in the low category based on those thresholds. So in terms of a comparison between then and now, I think we have even more people vaccinated. We have people who are getting the booster dose of the vaccine. Although we don't have 100% coverage in terms of our vaccination levels, we have good vaccination coverage in terms of about 60% of our population having at least one dose of the vaccine. moving forward, I think we need to stress the importance of the vaccine and its effectiveness in reducing the severity of any potential new variants or any following waves. I hope that we really don't see anything like that, but that's not really something we can predict at this point. So the vaccine has continued to show its effectiveness even in the Omicron surge, that people who were fully vaccinated and boosted had the highest level of protection. So in terms of kind of where we're at, we also have a lot of people who have had COVID in our community, whether it's they've had the Delta variant or the Omicron variant. And that also provides some natural immunity to subsequent infection from potentially a future surge. So given the fact that many people have had the disease and many people are getting vaccinated, the more people we can get vaccinated will just help us reduce any kind of severity or increase in case activity in the future. So I think the outlook is bright right now, and that's what I've been hearing from CDC and kind of the national spokespeople for monitoring the pandemic and making these decisions. But things are looking good right now, and hopefully we have kind of a nice summer to look forward to with limited case transmission.
Thanks, Nick. Just one more question here. I'm not sure if Nick wants to take this or if Jessica, you wanted to take a stab at it. I know with the vaccination numbers where they are now, just wanted to see if kind of that's what the health department had expected, kind of that 2/3 mark of the population having that 2-dose series. Just wanted to see if that number is higher, lower, or right where the health department expected it to be once vaccines had become as available as they are now that the third booster dose is available for people. Just wanted to get a sense of that, but that's my last question. And again, just want to say thanks for all the input that the health department's been able to put out for the public. We've really appreciated the assistance and transparency there. So thank you very much.
I can go ahead and start, and Jessica, feel free to jump in if I miss anything or if you want to add anything. But in terms of the kind of our expectations of what our vaccination levels would be, I think at first we had thought that there was the possibility to achieve kind of a herd immunity status across the population, not just in Rock County, but kind of across the nation. If we had achieved some estimates were between 70 and 80%. So I think that was the target initially. And as time went on and the Delta variant and the Omicron variant kind of came up and progressed through the population, I think leaders in the public health field realized that herd immunity and eradication of COVID-19 probably wasn't a realistic goal. And so getting as many people vaccinated and boosted kind of was the shift there. So, you know, we didn't set out with a goal or a target measure where we were like, we need to get 70% vaccinated. You know, it was get as many people vaccinated, offer the vaccine in as many different venues and locations and types of clinics as possible to get as many people access to the vaccine. And now what we're seeing is the vaccine is very effective at reducing severe illness, hospitalization, and death. And that's kind of the goal right now, is to make sure that people who are at high risk and just the general community have access to the vaccine and have access to the booster and the most up-to-date information. So that's kind of where we're at with things. And I think, like I said, 60% is a good number. There are other places in the country that have achieved 70 or 80% vaccination levels. But I think 60% is a good level of protection community-wide. And again, people who have had COVID in the past are also slightly protected from their previous infection, and hopefully all of those factors, along with additional people getting vaccinated and boosted, will provide future protection if there comes the need.
Thanks, Nick. I think you summed that up really nicely, and I don't have anything else to add to that. So, Austin, I want to thank you for participating today and for your continued participation in these media briefings. We will wrap it up for today, and just want to remind everyone that this has been live streamed on our Facebook page, and the recordings will be available on the Facebook page and the YouTube channel once the briefing is concluded. We invite you to tune in to our other live stream events that we have. We have our data segment on the alternating weeks. So next week on Friday at noon, we have our Numbers with Nick segment. Nick talks a little bit more in depth about the data behind the work that we do at the Public Health Department. So I want to thank everyone for your participation, and thank you for everyone who is watching on the Facebook live stream. If you're a member of the media and you would like to reach out to us to get some more information or participate in any future media briefings that we have, please send an email to media.publichealth@co.rock.wi.us, and I will provide you with the information or the link to participate. So until next time, be safe and be healthy, everyone.